So let's recap what we know about appendicitis. Does anybody have questions? Jamie.
Okay, so I know with appendicitis, it gets inflamed and our immune system will try to help battle the infection. So I know that that could affect our white blood cell count. So if I was to look at a patient's lab work, what might their white blood cell values look like?
That's a really good question. So one of the things that we do when we suspect that a person is suffering from appendicitis is we do a complete blood cell count. And in that, we are looking at their white blood cell count because when a person has an infection, they're going to have an abnormal amount of white blood cells moving to that area of the body to assist with the infection. And by getting this white blood cell count, we're able to discern an appendicitis rather than having a patient with something like pain from gas or from GERD. So when you have your complete blood cell count and you get your white blood cell count from it, the normal range is between 5 and 10,000 microliters. But with a person who's experiencing infection and inflammation, they'll be above 10,000, nearing 10,000 at the beginning stages of the disease and extending all the way up to possibly 16,000.
Okay.
Any other questions?
I have a question.
Serafina.
Where exactly can you find the McBurney's points?
Okay, so when you're assessing for appendicitis on a patient, normally the pain starts at the umbilicus and it moves downward to the right quadrant. The McBurney's point is the point between the umbilicus and the top of the hip, the right hip of the patient. When you find those two spots, your umbilicus and the right hip, right in the center of that is where your appendix lives. So during appendicitis, they'll have extensive pain in this region, and you can easily test this for rebound tenderness.
Okay.
Anything else?
Yes, I have a question. Okay, so you just said the pain starts at the umbilicus and moves to the right lower quadrant. Well, what if after all that pain, the patient says that they no longer have pain, it's been relieved? Are they able to go home from the hospital?
No. Now, it's really good that you asked that question because when a patient is suffering from appendicitis, they're suffering from inflammation of the appendix. That means that there's a distension and that the tissue that is the appendix is erected and it's pushing out away from the ileocecal valve. That is the valve that connects the end of your ileum to your large intestines. So they feel pain because it's infected. The thing is, it gets so infected and so filled with pustulence that it ruptures. And when it ruptures, it's just like if you've ever had an ingrown fingernail and you press all the pestilence out of that wound, the pain goes away. Well, it's the same thing when your appendicitis ruptures, and that's dangerous because then all that pestilence moves into the peritoneal cavity, and you can develop peritonitis. And that can lead to sepsis and even death.
Okay.
So if a patient tells you that they had pain, but it's all of a sudden gone, you still need to assess them for infection. You still need to check their white blood cell count. You'll need to reassess them for fever that might be coming on. You also need to speak with the physician about antibiotic controls that they're going to implement to help save the patient's life.
Okay.
Okay.
So what I want to do now is, now that we're recapping on our Prezi, I want to show you on this model, and we'll call this model Sammy. I want to go through and show you what an appendicitis is like. You like that name? Okay. So when a patient comes in and they say to the nurse that they've been feeling all this pain, as nursing students, we're taught to assess. And so the reason that we need to assess is because there's this whole sea of information that is happening. There are all these other organs that can cause pain in your abdominal cavity. You have your liver, you have your gallbladder, you have your spleen, you have your large and small intestines, you have your appendix. You even have the arteries that are running down the midline of your body. So a patient comes in and they say, oh, I just have all of this pain in my gut, and it's been a day and it won't go away, and you can tell it, they've said there's been some nausea or vomiting, which is a key sign of appendicitis. The main thing you need to understand is that when appendicitis sets in with a patient, the very first symptom they're going to talk about is pain. It's always pain first, and then the nausea and vomiting will come later. Also, when a patient complains about abdominal pain, you need to assess them to make sure it's not something like extensive gas or GERD. You also need to check the medical history for Crohn's disease or ulcerative colitis or lupus, any autoimmune diseases that can cause pain in the gastrointestinal region. Also, if your patient is a female, you want to make sure, you want to ask them about their menstrual cycle when they've had their last period, and also you want to assess pain around the ovaries and the uterus, because these things can lead to more complicated situations that have nothing to do with appendicitis, but you'll feel pain in the abdominal pelvic region. So when you're assessing a patient for appendicitis, the first thing that you want to do is test for rebound tenderness. And the reason that they call it rebound is because most of the time when you have an inflammation or infection, when you press on it, that's called palpating, you'll feel pain. But with an appendicitis, when you press on it, you're relieving the pressure because you're putting that appendix back into the place that it belongs in. So it relieves the pressure on it and the pain temporarily subsides. But then when you let go, the skin and the organs rebound and that appendicitis pushes back out, or the appendix pushes back out, and they'll feel pain again. They'll usually say, ouch, or that hurts. You'll also notice that there will be a hardening of the abdominal cavity because the muscles will do this thing that's called guarding. And it's an autoimmune response to protect your stomach because something is wrong. Here's a big key. When you have gas and your patient's suffering from gaseous pain, they won't have that guarding effect because their muscles want to relax as much as possible to allow for that distension of the body because the gas is filling that abdominal space. So when we assess for that, remember you want to assess for rebound tenderness. You also want to assess for nausea and vomiting. You want to ask them how long they've been vomiting or how long the periods of nausea last. You want to assess for a complete blood cell count so you can see the white blood cells, and you also want to assess for a fever. Again, to assess for the appendicitis, you'll start at the umbilicus, where the pain is first stated to begin, and you want to start at the right hip. You want to find the space in between, and that's where your appendix sits. So let's look at Sammy here. And Sammy, normally, the body in the abdominal pelvic region is like this. You have your small intestines, and it covers over the large intestines. And right down here is where the appendix sits. And the appendix is just past the ileocecal valve. And like I said before, the ileocecal valve is what connects the ileum, which is the end of the small intestines, to the beginning of the large intestines. Okay? When the appendix is inflamed, what will happen is, what usually happens is there is fecal matter that comes from the small intestines, and instead of moving into the large intestines, it gets obstructed into the very beginning, the entry orifice of the appendix. And because of that obstruction, it stops oxygen flow, it stops blood flow, which brings the oxygen to the tissues, and that starts causing inflammation, infection because of the blockage itself, and that'll lead to rupture. And this is what an appendicitis looks like, or can look like. Normally, your appendix could be something like the pinky, but then it'll inflame and swell because it has pestilence building up in it, and it can become inflamed and reddened looking like this. So, when we were talking about the dangers of appendicitis, this is what will happen. You have an appendix, it's filling with pestilence. The patient's saying, Sammy's saying, I feel pain. This hurts really bad, and they're in the hospital, and you give them some pain medication, and you're assessing them, and all of a sudden they go, actually, you know what, it's starting to feel better. Well, this is where it can become peritonitis because of sepsis, because what has happened is the swelling has become so distended in the appendix that a rupture has occurred. Let's see if we can do this. And you'll have a leaking like this. It's a very strong appendicitis.
There you go.
So when you have a rupture, you have that pestilence that moves out. And normally what will happen is this model here, it would normally drain, because you'll have all this pressure that's building up in the appendix itself, and it wants to get out. So it'll drain, and when it drains, it's going to move into the peritoneal cavity. And your patient will say, oh, I feel fine now. But you know that all of that is moving in there, and that's bacteria and that needs to get out. So then you're going to have major surgery. That's to clean the abdominal cavity of all that pustulence, and also to get rid of the appendix and remove it surgically. The good thing is, we don't need the appendix to sustain our lives as human beings. We can take the appendix out and live and function in normal daily life just like everybody else. And today with laparoscopic surgery, we can do this it's an invasive surgery, but it has minor damage to the body. It's a real quick healing time, and it's very successful. In the past, there used to be a 50% survival rate from appendicitis, but today, because of medical technology and because of antibiotic use and control, the survival rate is up by 90%.
Nice.
Okay.
So any other questions?
Thank you.
What's the prognosis? So, pretty
So,
good.
the prognosis of a person with appendicitis is this. You have pain and inflammation in your lower abdomen. You go to your doctor, they diagnose, they confirm it's appendicitis. The appendix must be removed. There are some procedures that are non-invasive that you can do to prevent appendicitis, but once the appendix has inflamed, you do need to take it out by procedure. Once it's taken out by procedure, a person can live a long, happy life. They'll be able to participate in sports, recreational activities, swimming, climbing, running. They'll be able to raise their kids, play with them on the playground, all the mobility and activities that a person could expect to do as a healthy adult.
Okay.
And that's our presentation.